We are aware of new numbers that were reported overnight from China, which added an additional 325 cases and 1,290 deaths from Wuhan. And this was done in an attempt to leave no case undocumented. What we understand is that they've used an existing law of statistics to find these cases. And what they did is they reviewed different databases. They looked at the database that is kept for all of the confirmed cases. They looked at their funeral service systems. They looked at hospital systems. They looked at laboratories to see if there were any duplications or if there were any cases missing. They looked for cases in fever clinics and hospitals, and detention centers, and elderly care centers as well. And what they have reported is that the discrepancies in these cases were due to a number of factors. First is that the healthcare system in Wuhan was overwhelmed at one point, and some patients died at home. Secondly is that medical staff were delayed in reporting of these cases because they were focused on providing care for those patients and they didn't fill out the forms in time. Next is that there were additional locations that were built. And if you remember, in Wuhan in particular, some of the hospitals themselves were overwhelmed. And so they set up these makeshift hospitals that they called them, which were essentially stadiums and other facilities where they put mild cases to be cared for. And in those situations, the reporting wasn't done in a timely manner. And so those cases were added.